everybody! Welcome to the 114th edition of John News. I'm John Wortman. With me today is Roger Mazzi, an internationally recognized expert on diabetes. Hi, Dr. Mazzi. Welcome to John News.
Thank you for having me this morning.
So, what is diabetes?
Well, actually, diabetes is not a single disease. It's at least two, perhaps even more diseases. One is called type 1 diabetes, where an individual no longer produces insulin, and the other is called type 2 diabetes, where insulin is produced, but it's not efficiently utilized.
Okay. I'd like to talk about type 2 diabetes. Would you say that type 2 diabetes is a public health crisis?
Yes, in the United States and throughout the world, type 2 diabetes is often either the second or third leading chronic disease.
I've heard that diabetes affects people in underserved populations more than others. Why is this?
That's a very good question. There are many theories to explain that. One is purely genetic. So type 2 diabetes is a genetic disease. And we believe that among certain people where type 2 diabetes reaches almost 50% of the population, and these are often underserved people, part of the reason is what is known as a thrifty gene theory. And that gene favors individuals who can store rather than burn fats and glucose or carbohydrates. If you can store it, you're going to store it primarily as fat. And if it's stored as fat, you become obese. And type 2 diabetes is a disease of obese individuals. A second theory, much simpler and perhaps even more compelling, is that as we move from an agricultural type of living to an industrial revolution where you don't have to work to get your food and where people are much less activity, it makes it possible for you to get your food much more easily and to get a lot of food. And the combination of the two leads to obesity. There is a third factor, though, that many people miss. Many people with obesity have obesity in pregnancy. The child is often born obese. So you're producing obese children.
What can we do to prevent this?
Well, the genetic part is very difficult. The environmental part, however, you can do a lot about. Increasing exercise, avoiding over carbohydrate and fat diets. A combination of those factors, as well as early screening. You can still have glucose intolerance. And once we know that, there are treatments that we can give, some medications.
But can people even afford these medicines?
Well, luckily, it's not primarily medical interventions. It's lifestyle interventions. And in truth, eating less is more affordable than eating more. And eating good foods is better than eating foods that are rich in fat and high in carbohydrates.
Wow. This has been a really interesting and informative episode. Thanks for being on John News.
Thank you for having me.
So long, everybody. Bye.